Hi, this is Dr. Paul McNeill, and I just wanted to take a few minutes to explain what varicose veins are and why we treat varicose veins. You can see here an example of somewhat mild varicose veins on the thigh and calf, but as time goes on, the veins become worse and can actually cover the whole leg from top to bottom. And in a worst case scenario, if treatment is not done, veins can be complicated by blood clots, irritation of the skin, leg swelling, and even an ulceration of the skin, and we don't want that to happen to you. So our job is to diagnose the varicose veins, why they're there, and then get them corrected. So as impressive as those photographs are of the various stages of varicose veins, it's equally impressive when I talk to patients and they tell me just how much these veins seem to be affecting them. I have patients who normally would walk in the neighborhood for exercise and they find they can't do that anymore very easily, or as they get to the end of the workday, their legs are throbbing and aching and their legs are swollen or their feet are swollen. And all this stems from that downward flow of blood in the legs. We want your legs to be healthy. We want you to get back in the circulation of life, to get back doing the things that you enjoy with yourself, with your friends, with your family. And it all starts by getting that circulation working, by getting the blood returning to the heart and not remaining in the leg with varicose veins. When we discuss veins with patients, we always talk about the veins kind of being organized in the leg like a tree. So there's a trunk part, and there are branches that come into the trunk. The tree is actually upside down, so all the blood is flowing up the leg, into the trunk, and back to the heart. The most important thing about the veins is that they're designed for blood only to go up in the direction of the heart and not down towards the feet. When veins stop working properly, the blood starts flowing down towards the feet because the one-way valves inside the veins have failed, and now blood can be pulled down by gravity. This eventually causes the veins to become enlarged under the pressure of gravity, and this is where all the problems begin. So in order to figure out what's going on in your leg, we use ultrasound to get a roadmap of the circulation. The ultrasound actually shows us where the veins are not working properly, and that begins the planning for your treatment. As you can see here, fairly extensive varicose veins can be transformed into a clear leg and a healthy leg that will allow you to pursue a full range of activity without leg swelling and without discomfort. And with a few simple treatments here in the office, it can be a life-changing result, not only in the way the leg looks, but also the way it feels and the way it releases you to have a fully active life.